Published in the Journal of Clinical Sleep Medicine, a powerful extract of the ancient spice saffron may help counter poor sleep. Now, the study also reveals that at least 30% of the global population suffer from a sleeping disorder, and as a result, their mental and physical health are impacted negatively. Joining us now on Skype to tell us more about some of the solutions to this problem is Giulia Criscuolo. She is a pharmacist, a complementary medicines expert and life coach. Giulia, a very good morning to you. Thank you so much for joining us. Welcome to Morning Live.
Hi, Simpy. We're lovely to be with you again.
Now, let's start with the recent study, Giulia, that shows that an extract of the spice saffron may help counter poor sleep. Can you tell us a bit more about that?
Yes, this was a study done in Australia and published in the Journal of Clinical Sleep Medicine. And what they found, Simpy, was, as you said, this extract of saffron, which they call Afron, was given to a group of 63 patients. And they found that after 1 week of taking this extract, the quality of sleep improved dramatically after just 1 week, and there were no side effects reported. So this is a wonderful thing because many people suffer with sleep disorders.
I mean, one wonders what really causes the sleeping disorders. I mean, break down for us what these sleeping disorders are and just how common they are, especially in South Africa.
Well, sleep disorders can vary from just good old insomnia, where you either battle to fall asleep or otherwise you fall asleep but then you wake up after a couple of hours and can't fall asleep. You also have something called sleep apnea, where during the night you stop breathing for a short period of time, very short obviously, and then it wakes you up. People also suffer from restless leg syndrome, where you have very uncomfortable restless legs, which prevent you from falling asleep. And then there's narcolepsy, where you just suddenly fall asleep. And we found with Wits University, they've got a sleep laboratory, and they found that 40% of people have sleep apnea. And also in a US study, 70% of people said that their quality of sleep dramatically deteriorated after COVID-19 or during COVID-19. So sleep disorders is unfortunately quite a common problem.
And how does that affect our health? And for those that are struggling with sleep disorders, what tips do you recommend for improved sleep?
Chronic lack of sleep and a chronic sleep disorder can dramatically influence your health. You find that your immune system becomes compromised, so you get sick more often. You have a much higher risk of many chronic diseases like anxiety disorders, depression, alcoholism, cardiac disease, diabetes, Alzheimer's. It makes you age faster. So it really has a dramatic impact on your health, and that's why it's really important to address the problem. Obviously, we always look at good nutrition. Make sure that your caffeine intake is minimal or reduced or completely eliminated, because we know that caffeine is a stimulant. And remember, Ceylon tea also has caffeine, as do cold drinks. So if you suffer with any kind of sleep disorder, cut out caffeine. Make sure that you have good quality protein, especially in the evening. Good quality protein contains amino acids like tryptophan, which are very helpful for producing the hormones that help you sleep. Also make sure that you manage your stress. Stress is, in all our lives to some degree or other. And so we need to find ways of managing it, either through good exercise, spending time in nature, and finding ways that you can fill your tank. So that you're not drained and always tight like a clock. Also, a good sleep routine is very important. Remember, like if you're driving a car at 100 kilometers an hour, you're not going to just drive in your driveway and then stop. It has to slow down to 50 to 40 and eventually stop.
Yes.
And it's the same thing with our nervous system. We have to find a way of slowing down.
Yes.
So in other words, stop all activity on your computers and devices at least 1 hour, even 2, before you go sleep. That includes sometimes watching TV. Make sure that your bedroom does not have any electronic devices, because they have an electromagnetic field around them which can affect your sleep. That includes alarm clocks, electrical alarm clocks. So cell phones should not be on, should be out of your bedroom at night. Have a room that is very, very dark. And because that helps you sleep. And also, if you're struggling, remember good supplements can really help, like saffron, like vitamin B12, magnesium, curcumin, which helps inflammation. There are things that can help you get to sleep and stay asleep, and make sure that your sleep disorder is addressed and you come back to a good sleep routine.
You just mentioned supplements, Giulia, and I mean earlier on you touched on the intake of protein and as well as amino acids. One may think of supplements because of their hectic schedule. So what about these supplements and medication that assist with sleep? Is this healthy? I mean, which one do you recommend to aid sleep?
There is no one size fits all, Simpiwe. You've got to look at your individual situation, because there are, of course, Schedule 5 prescription sleeping pills, which many, many people take, and there is a place for that. The point is that if you become dependent on these sleeping pills for chronic periods of time, for years and years and years, then dependency does set in. Of course, you can come off them with consultation of your doctor. So there is a place for them, because if you really have a chronic sleep problem, you need to sleep. And sometimes a sleeping pill can be helpful. However, I would advise people, before you go onto that regime, try changing your lifestyle, as I've said, with what I've mentioned, and then take natural things like chamomile tea, valeriana, saffron, the supplements I've mentioned. Those can be very, very helpful. And as the study showed, this extract of saffron has no side effects. And many of your prescription sleeping pills, unfortunately, do, dependency being one of them.
All right, Giulia, we're out of time, unfortunately. And just briefly, in recent months, many have been complaining about how the lockdown and working from home disrupted their sleeping patterns. What can they do to get back to their normal sleep patterns?
I think the important thing is to manage the way that you structure your life.
Okay.
Have time where you switch off. You switch off your computer, you stay away from Zoom meetings, and you go outside. Take a walk in nature. Do the things that bring you joy, and very intentionally make time for that. Don't put that as, well, maybe if I have time, because it'll never happen. So be very intentional about taking care of yourself and find out what your nervous system, your body needs to relax and unwind, whether it's spending time in nature, with family, watching a comedy, doing something that, as I said, fills your energy tank.
All right, Giulia, thank you so much for those words of advice. We do appreciate it.
Pleasure. Bye, Simpiwe. Thank you.
All right, cheers. Have a good day. That was Giulia Criscuolo. She's a pharmacist, a complementary medicines expert and life coach. And we've been speaking to her about how poor sleeping patterns can impact our physical and as well as mental health. Now, if